All right, everybody, this is our weekly COVID-19 update. I'm joined by Dr. Phil Huang, the Dallas County Health Director. Dr. Huang, thanks so much for talking to me today.
Thank you.
So we want to go over some of the questions that we keep getting from people. And I'd say the biggest one is, when is it going to be my turn? Obviously, you guys have a long wait list. The Fair Park is running at full steam, at least as much as you have supply. How quickly are you guys moving through your wait list? Do you see us kind of changing things anytime soon?
Yeah, we're actually, right now the state has approved the 1As, 1Bs, and then they added the 1Cs, as well as school teachers and other staff that work at schools, K through 12 school settings and daycares. So, 1As are healthcare, frontline healthcare workers, 1Bs are persons 65 or older and that are or persons 16 to 64 with underlying health conditions, and then 1Cs that they added are 50 and older. So we're doing all of those. We're starting to really make a dent in all those that have signed up on the waiting list that are in those categories, and also, as I mentioned, the K through 12 school teachers and daycare teachers are also in those. So we're definitely, if you're in those categories, we're getting through, quite a few high percentage of the people who have signed up on our list in those categories.
Obviously, it's up to the state to decide who's eligible. Several states have already moved into everybody, 16 and up. Some states have announced a date for when that'll happen. It's not within your control, but at the rate that we're moving through things, do you think we'll reach the 16 and up, everybody 16 and up, before that May 1 deadline that the president has laid out?
It all depends on the vaccine supply, and we keep telling the state and the feds will take whatever they can give us, because that's our limitation right now. So we have more capacity that we can see people at Fair Park, and we want to optimize that. And if more resources, more vaccine becomes available, we want to get other venues, able to start providing that.
Some states have started taking, or some providers, I should say, have started taking vaccines directly to people out in the community, as opposed to just having these mega sites. How are you guys making sure that the vaccine is distributed equitably, that it's reaching everybody, even people who might have some issues going to those sites or signing up?
Sure. I mean, the vaccine that we're distributing, we're making it by appointment. We're getting the people's names off of the people who signed up for a waiting list. I mean, in some of we have the 17 priority zip codes, and sometimes we have actually, for the 17 zip codes, gone through the people in those categories that are on the waiting list. So there are times when we can go out into the 17 zip codes and actually get people signed up immediately. And then we've actually tried to get some bus service to bring some of the people in to Fair Park if we have that available.
One story that's kind of made people laugh today, but it's a serious story at the same time, is Krispy Kreme giving out free donuts to people who have vaccine cards to prove they've been vaccinated, kind of a little incentive. And again, it's a funny story, but do you feel like we need more incentive, not necessarily donuts, but whatever it takes, more incentives, whether it be, PTO from employers or anything to incentivize people to come out to sign up and get vaccinated, get past some of the hesitancy?
Sure. I mean, we definitely want everyone to sign up and get on the waiting list or get on someone's waiting list. And we right now we still don't have all the available vaccine to take care of everyone who's already signed up. There will come a point where, hard to imagine right now, but there will come a point where everyone who's wanted it will be able to, have received their vaccine, and will be dealing more with the people who are more hesitant about it. We still want to address hesitancy right now. We want people we want to address those concerns or questions that people have, so that we address that early on. So it's great if people incentivize it. We want, again, everyone to get the vaccine. It's in all of our interests to get as many people vaccinated as we can.
And then I just curious, are there any questions, whether they're about the vaccine itself or about the process, that you guys keep hearing or keep getting, you want to clear up, you want to make sure people know?
Sure. Some of the things, that have changed, and this does change every day, and we apologize. Some of it's based on, the availability of vaccine, and we don't get some of our shipments until the last minute, or no, we don't want to schedule people out here and then not have the vaccine available. We have been then having to change some of our scheduling so that Mondays and Fridays are going to be the days where we're able to do new first dose appointments. And then Tuesday, Wednesday, Thursdays are going to be for the people who got their first doses of Pfizer out here to get their second doses. So people who might have gotten their first doses of Pfizer either on a Monday or Friday, we're sending out notifications to move them to Tuesday, Wednesday, or Thursday. So, check the website for the latest in the scheduling. I know it gets a little confusing and complicated, but we're just trying to deal with all the different changes on, when we get vaccine and making it available.
Awesome. Well, I appreciate your time. Thanks so much for clearing up everything. And I appreciate you taking the time to talk to us. You take care.
Sure. You too. Thank you.